Welcome to Health Stories. Today, we are about to dissect the existence of Ebola virus. So, for that, we'll consider a case study of a village in some parts of Africa. There was an old guy. He purchased a bat meat one day, and without knowing that, he had some traces of blood in his hand, which he was touched by his eyes. And this is how it all began. Later that day, he went to his house, prepared the meal, and had a supper out of it. After a few days, he suddenly started to feel sick, and within no time, his medical condition was very down. So, he requested the family members to call for the hospital nearby, and the daughter ran and she informed the nurse about the illness of her grandfather. She immediately understood, but by that time it was too late and he could not survive. So, this is how the Ebola virus came to that village. And later on, what we are going to discuss, how we were able to handle it. The family was in stress, complete disarray, and the sister advised that this could spread through sweat, eyes, tears, nose, saliva, puking, excreting, and finally urinating to go with breastfeeding, sexual transmission of liquids, hands, bloods, and many other things that is being connected to the patient at that particular point of time. It can spread through all three means: eyes, nose, and mouth. That was the clear instruction given by the sister that was there. The unfortunate thing was the grandfather could not survive as it was bit too late. But the message was loud and clear. The self-sanitization was very important. So this was clear instructions given by the nurse to all the family members to sanitize themselves properly. Then followed by the ritual of taking the dead body with the proper healthcare professionals who came with their all medical equipments and protective suits. And as usual, they did a great job by taking the bodies, sanitizing the entire house, and finally sanitizing the bed that he was there. But the job was not done. They took him in a proper packet and made sure that no human contact is there, who's not professionals. It was a sad moment for the family, but the next step was to clear all the belongings of the grandfather in which he was sleeping, which included beds, clothes, and everything, and that was burned in order to negate any Ebola virus that can have an impact on the village or the family. So this is the first phase of the things, or the sign of the things that the village was seeing. Next thing was to educate all the village people how deadly the virus is and what can be the consequences, which was explained by the senior people from the society of that village and agreed by all the family members to go with the villagers. So that was the first sign that people were trying to understand the impact that it can have on the entire society or the village as a whole. Next important step was to observe the family members of the deceased person, as the doctors kept on doing the periodic check for all the family members and jotting down the behavioral pattern in terms of medical thing. As the days passed by and after the rigorous detailing of the health system of the family, one fine day it happened, there was some change in the behavioral pattern in terms of medical thing with the mother. So daughter immediately rushed to her and she thought it can be Ebola and suggested to go to the pharmaceutical thing. But father was a bit stubborn and he thought that he might not see his wife again. So he was insisting on taking her to his cousin's place, which was strictly objected by his daughter. But after her perseverance, the family agreed to take her to the hospital, which was difficult sign, but her father said yes to it. And then finally she was taken to the nearest hospital. After visiting the hospital, she was immediately separated from the family members and taken care by the medical professionals who did a wonderful job and started the treatment. So now the next step was to see how she is recovering. As the days passed by, the health was better and the condition was better with the efforts that was put forward by the medical team. Now the daughter can talk to her mother via phone as she was not allowed to meet her directly. With proper food and proper care, she was recovering good. As the days gone by, she could see her mother bit well and can meet them as well through a distant place. Finally the day arrived when her mother was completely fit and fine and she was sent home. The message was loud and clear. The doctor, they observed the entire village and they noticed that the village has understood the guidelines that was issued to them of proper hygiene and not be shy to go to the doctor in case of anything happens. This is how that village eradicated Ebola with their sheer perseverance, zeal, and vigor, and the ability to understand what not to be done. Hope you like this video, and you can let us know if you have any questions. Please subscribe to our channel. The final message from this video is all the answers is possible, but we need to work as a community. We need to work as a system